You can have negative effects on production and health. That's the no-brainer. The cost of a disease outbreak can be much greater than the cost of a vaccine. Some diseases can be really difficult to get rid of once they're established on the site. And just general welfare of the animals, right? It's the right thing to do for these animals to help protect them against diseases. So just a basic review, routes of administration. Probably most common is going to be injectable, intramuscular, shot into the neck. This is always a good time, I think, to review appropriate needle size. So I kind of threw this little chart in here as a guideline. I think that's one thing sometimes people goof up is the appropriate needle size, for a pig. So generally, if you're looking at pigs in farrowing, if they're still on the mom, using 18 or 20 gauge needle. I'm usually using about a 1/2 inch on those ones. Nursery age pigs, up to anything from 15 to 50 pounds. 18 gauge needle, I'm usually a 3/4 inch. Finishing pigs, 16 gauge needle, 1 inch. And breeding stock, 16 and a 1.5 inch needle there. And some subcutaneous injections. We don't really do that much in pigs, so pretty much every shot you're doing is right into the neck. Probably everybody knows you make your little triangle behind the ear, right? That should be your injection site directly into the pig. Also, for vaccinations, there is some vaccines that you can do orally, so either running through a water medicator or drenching directly into the mouth. So some of the diseases we're going to hit. So diseases that you should have a plan to control. We're going to talk about, I think we're going to get into the breeding herd first and then go into growing pigs if I remember how I set this up. So PRRS, PCV2, so circovirus, SIV, swine influenza, PLE, that's parvovirus, leptovirus, erysipelas. I threw those together because they're vaccinated. You give one vaccine, that's why I kind of clumped those together. Mycoplasma pneumoniae, parasites, we're going to talk about parasites in a whole nother lecture, so I'll get to that later. But, those top 4 can cause big problems reproductively, can cause pigs to die, poor performance in your downstream herd. These can really have devastating effects if they get into your herd. So as far as standard recommendation, by no means is vaccine one size fits all. For swine facilities. When I make up a protocol for a farmer specific for that farm, I give them a specific protocol. So, there's some things that are pretty much always standard, but it's very individualized. So I don't believe there's a one size fits all. So for your sows, if you were only going to do one vaccine ever, this is the one I would do. So it's your PLE, so your parvovirus, lepto, and erysipelas. So Verisure Gold is the big brand name that probably everybody sees. So that is given pre-breeding, should be given pre-breeding. And the first time the animal gets that shot, they need 2 injections of that. So generally 5 weeks and 2 weeks pre-breeding. Some people do 6 and 3. I don't really care all that much. As long as you're getting 2 shots pre-breeding, the first time the animal sees that vaccine. On subsequent breedings, 1-time shot, 2 to 3 weeks pre-breeding. Super important. So I've had the cases I've had where I've been at organic ABF sites that they're not vaccinating. I go to places where they literally don't do anything. So I show up to these places, they're having a host of problems. We don't know what's going on. We can't get sows bred. We're having all these reproductive issues. We're having stillborns, prolonged gestation, the list goes on and on and on and on. We don't know what's wrong. MSI always pull blood on sows, and I almost always find this because it is ubiquitous. It is everywhere. Parvovirus, bad disease in dogs, but if it affects the GI tract in dogs, affects the reproductive system in sows and your breeding herds. I find this almost all the time, and it's because it's around. It's everywhere. The sows they're not going to act sick. Your breeding herd, they're not going to, act like they feel bad. You're just going to see downstream effects. You're going to see problems with reproduction. Lepto, we'll get into this more later. Lepto is more of you can get from wild animals, spread through the urine of wild animals. Erysipelas is an environmental contaminant that lives in the soil. So these things are around. Also, I throw in influenza for the required vaccine, and honestly, I do that a lot of times because you can give that Fairshore Gold product, you can mix in with the Flusher XP, this is all Zoetis product, and you can do those shots combined, so that's kind of why I throw that in there. Might as well do it if you're doing the PLE vaccine with them. Any new replacement breeding stock that you're bringing in, I like them to get sometimes it might be a boost, sometimes it might be the first time they've seen it, depending where you're getting your breeding stock from, or you're making your own breeding stock. Mycoplasma high pneumoniae and PCV2, so circovirus. Almost but the vast majority of those vaccines actually come combined in the mycoplasma and the circovirus together. So usually that can be a one-shot deal. So I do like them to get that either, when you're selecting them, or they're coming onto your farm if you're buying them in. Ileitis is another one that is every animal should get either on entry if you brought them in, or given some time during the growing phase if you're making your own breeding stock. And we'll get more into these. As far as situational vaccines, it depends, right? So E. coli and Clostridium, these are not for the breeding herd, these are for your growing pigs, these are for the piglets. So there's several products out there. LitterGuard is a big one, it's called LitterGuard LTC. That's a big one that's used, and you're going to be using that pre-farrowing. So again, this is a 2-shot deal if the animal's never seen it before, so a gilt, that would be a 5 to 2 weeks pre-farrow. On subsequent litters, it's only 1-shot deal, 2 to 3 weeks pre-farrow. But that you're trying to pass immunity onto the piglet. So you're trying to help out with piglet scour. So you're not really doing much for the sows. It's immunity that you're passing on to the piglets there through the colostrum and the milk. Atrophic rhinitis, disease that was a big thing, I don't know, before I was born, I think, in the 70s or so. So twisted snouts. Doesn't seem to be as big of a problem. In some cases, some farms are still probably seeing some issues with that. It's called like Pasteurella and Bordetella are the bacteria associated with that. And the issues that I see with that now are not you don't necessarily see a big twisted snout like you used to see, but you wouldn't notice it until you cut the pig open and looked at the nasal turbinates, where you'd see like cartilage damage and their turbinates that kind of looks like they've been rotted out. So it's not as acute or severe as the disease used to be. HPS, that's Haemophilus parasuis, that's a bacteria. Again, situational, this is for immunity to the piglets. It gets passed on to help decrease the prevalence of that in the downstream herd.
Dr. Laura, just to clarify, you can still vaccinate and qualify for organic production, correct?
Yes, so that's a good question. Yep. So I always tell people to check with their buyer. So there's certain, requirements or regulations that a specific buyer might set for things that they allow or do not allow in terms of medications or vaccinations. But most of the organic herds that I work with still allow vaccination. There's 1 or 2 guys that I deal with that say, we can't do anything because that's what the client requires, which I don't agree with at all, but pretty much all of my organic operations vaccination still allowed and should be. Those programs are ones that have a very robust vaccination program. So we'll delve into all this a little bit more. So let's talk about the diseases a little bit. So I've already introduced this. PLE, parvovirus, leptovirus, erysipelas, big time reproductive failure. What I mean by that, it's a whole host of things, right? But it's poor conception rates, irregular returns to heat, not returning to heat, stillborns, mummies, abortions, kind of all of the above, right? And so all these diseases, depending on the disease, can look a little bit different, but they all have most of the same reproductive issues. With parvovirus, you end up kind of seeing more mummies. That's more indicative of parvovirus. With leptovirus, you will see in the sows, you can actually see them become sick, potentially. So fever, off feed, abortions as well. Again, sorry, with the parvovirus, I think I said this before, the sows generally do not act sick. So erysipelas, you usually would see an outward sickness of the sows, the breeding herd. So they have lameness, fever, bacterial septicemias, death. Kind of the big thing is that it's called diamond skin disease. If you've ever heard that term, they can literally get these lesions on their skin that look like diamonds or rhomboid in shape. So again, vaccination usually works out to 2 to 3 times a year if you're on a regular breeding schedule, right? But if you're at a site where maybe a sow's only getting bred once a year, I would still boost her again at some point later on in the year if she's not one that's continuously bred on a routine schedule. I also, let's not forget about our boys. I do like to give the boars a boost of that just to help keep the herd immunity up. So twice a year, giving the boars a fair share gold shot's a good idea as well. Again, like I said, it's a 2-shot deal the first time the animal receives the vaccine. After that, it's 1 shot on subsequent breedings. So PCV2 or porcine circovirus. So again, reproductive failure, like all the things we talk about, mummies, a good example of that. In the growing pigs, what you're going to see is a failure to thrive or just wasting. I like to tell people it's like the on button got turned off. So if you just see these pigs at 70 pounds and they just stop growing, they literally stop growing. And once you get up to the rest of the herd's at 200 pounds, that other pig's still going to be 85 pounds, just wasting away to nothing. I mean, no matter what you do, they're not responsive to antibiotics. It really suppresses their immune system. They're susceptible to a lot of other diseases. It's bad, and PCV2 is just about everywhere too. It's generally ubiquitous. So the vaccine for this is good, so you should be vaccinating. There's no reason not to. As far as vaccination goes, so the breeding herd depends, right? So if you're making, let's say you're making your own replacement stock, probably your growing pigs are going to get a PCV2 shot sometime weaning or a little bit after. I like to boost them again when you're selecting that gilt as, okay, she's going to live in my breeding herd. So I'm around, maybe 4 or 5 months of age. I like to give them another shot of that. She's going to be hanging around for a while. So other than that, they generally don't need to be revaccinated unless there's some other issues going on. Usually she should be good for the rest of her adult life. So SIV, swine influenza, that is a clinical signs of influenza, so severe respiratory disease, coughing, high fever. So what causes the reproductive issues with SIVs? You're going to see a lot of abortions, and that is due to that high fever. That's what's causing them to abort. So, and that's all in the acute phase. There is some swine herds that kind of just always have flu a little bit, or they're circulating around at low numbers. Then the effects can be a little bit lessened. You don't see as acute issues with abortions and whatnot, but it still definitely affects the herd. Usually flu when it comes in hard and fast, so the pigs get affected quickly, everybody's coughing like crazy, fevers, that kind of thing, and then usually it kind of blows through fast, but it hits everybody hard pretty quickly. And we're talking about fever, what do I call a fever? Depends a little bit on the temperature. Usually above 103, I'm calling fever. So in the summertime, sometimes I'll go a little bit higher, because sometimes I'll temp sows that are completely healthy, hanging out, doing fine. They might be 103.5 or something in August, you know what I mean? So sometimes I take that into account with all the other signs, right? Are they lethargic? Are they off feed? that sort of thing. But usually above 103 is what I call a fever. They say normal pig temp is 99 to 102.5 or so, but so there was some variability there. Also depends how long you're chasing around that sow in the pen before you can get a temperature on her, right? If you're chasing around for 15 minutes, so that you might get an elevated temperature just from that. So always got to kind of take that into account. Vaccination programs, like I said, so this can be that Fairshire Gold you can reconstitute with a FluSure XP, again, a Zoetis product. I'm not being paid by Zoetis, it's just the most common one out there. But so if you're doing it with your PLE vaccine, it's going to end up being 2 to 3 times a year. You can get a little bit of immunity from that sow vaccination to the piglets through the colostrum, but it doesn't really last that long. If you do have the big problem with flu in your downstream pigs, you can vaccinate your growing pigs as well. I should say this, flu vaccine is not going to prevent flu, right? Pigs are still going to get flu. What you're going to do by the flu vaccine is decreasing the severity of clinical signs. So, yeah, exactly. That's the best we got. So, it's not going to prevent anything. This vaccine will, nothing's 100% right. This vaccine will almost always prevent this disease. This vaccine will almost always prevent this disease. I'm not going to say it's 100% because it's not, right? But it's good. These are good vaccines. These will prevent these diseases. We're decreasing the severity with the flu vaccine. Mycoplasma high pneumonia. So this is a bacteria, causes cough. It's generally thought of as a finishing pig type disease, so mid to late finishing, causes coughing issues. To be honest, almost all, I don't want to say almost all, but a lot of herds just kind of have this around. Usually doesn't cause, death or severe issues, but depending on the prevalence at the farm, you can see reduced average daily gain or feed conversion. Again, a lot of that just depends on the severity and that specific flow, but just reduced performance in these pigs. So again, because it's combined with a circovirus shot, you're giving it. So again, it can be given at the same times as you're doing the circo shot. Also to manage mycoplasma, some people, there's strategic feed medication that you can use with the VFD. And also helping to control other diseases kind of keeps that at bay. But again, with this one as well, the pigs are still going to get it. Probably most of the pigs have it. You're kind of just decreasing the severity. Vaccine's okay, it's not great. If somebody can figure that out, they'll make a lot of money. Okay. PRRS. Everybody should know what PRRS is, sitting in this room, I hope so. So this is probably the most economically devastating disease that we have in the swine industry. I mean, I realize PED came, I don't want to say it went. PED is not around as much. We're still are finding it. Hopefully we're over the worst of it. But when you're talking about a disease that's been around since the 80s, that there's no great vaccines for, it's very easily spread. It's caused really devastating effects at farms. It's constantly mutating. There's a lot of strains of it. This disease is a bad disease. So clinical signs, I'm just listing a few, but it really makes everything at the farm terrible. So reproductive issues, abortions, stillborns, mummies, death in the sows, death in the piglets in the acute phase. Just decreased piglet viability. Usually in acute phase 2, you're having a really high pre-weaning mortality, and just poor performance in the nursery, but really all along. I mean, this just devastates the pigs from day one until they're marketing, or it could affect them at any age. This is, and the strains that have been circulating over the past couple of years it's called a 174 strain, and I've seen it in the acute phase in sow farms that are naive, and you're talking 40% pre-weaning mortality. You might be losing 20% of your sows that are just dropping dead. I mean, just really bad, really devastating effects, especially on, if you go to a 5,000 head sow farm, that's a lot of animals. So really bad disease. Control and prevention, the best way to not deal with PRRS, don't get it. So it's easier said than done. Good biosecurity, you guys are in a great geographic area, so obviously your risk level is low, but good biosecurity is always important, but especially for this, you really do not want to get this disease at your farm.
How prevalent is that in Lancaster County?
Honestly, not in Lancaster County. I'd probably say in the state of Pennsylvania. We're actually still pretty good compared to the Midwest or down North Carolina. Probably about 25% maybe or so of the herds, and that ebbs and flows. We're getting into disease season now, so I expect that to kind of sometimes ramp up. Summertime is better I would say better for birds, but yeah, you're gonna see less birds and the heat kills it. You're gonna see less transmission during the summer months. During the winter, colder months, we do see this ramp up.
A thing that concerns me is the people from Connecticut and Massachusetts and other states go to New Holland, they buy pigs, they bring them back here, and they resell them to go out into the world.
Oh gosh, yeah, that's a breeding ground for probably birds.
They're not supposed to do, and I've had this talk with, the state inspectors and things like that. We're so understaffed, and if there's not a problem, they're not gonna go look for it. So that's a huge concern of mine.
It should be, yeah, it should be.
I do not vaccinate for that. Am I stupid?
No, I don't think so. So if you guys were all vets who were sitting around talking about PRRS vaccine, there's probably a lot of people getting in fights about if you should use it or not. So some of it's opinion. Again, or not again, it's the first time I'm saying this, the vaccines, it's just okay. You're decreasing clinical signs. You're not preventing PRRS. There is no PRRS vaccine that is going to prevent PRRS. If somebody figures that out, they're going to be a billionaire. So there's too many strains.
What I do is I have not bought a gill in 25 years.
Okay.
They've all come from my farm. I buy good boars, and I quarantine them for a month.
Good.
Before I bring them down and introduce them into the herd.
Good.
So I really have had no problem with that. When that was big, and whenever I hear anything breaking out, I don't let people with other pigs
Good.
come to my main barn. It's an off, kind of off to the side thing, because that's what really concerns me. It's not my full limit, but it's a big part of it, so I don't want to lose it.
Yeah, no, it sounds like you're doing the good thing, the right thing. That's what would scare me too. Slaughter plants, buying stations, they're breeding grounds for all sorts of diseases, PRRS included.
Right.
So that's what makes me nervous. Any sort of trucking, whether it be just market trucks, dead haul trucks, any sort of trucks, feed mill trucks. Probably less of a risk of that around here, but that's certainly in more swine dense area. Feed mill trucks are a big risk as well. I would say vet trucks, but probably around here it's not as big of a deal. But we're also a risk factor as well. But yeah, like you were saying, so that best case scenario, if you're bringing a pig from somewhere else and they're not testing for you, which maybe that should be the one thing too. Especially when you get into bigger operations. I mean, when people are buying in pigs from other sources. A lot of times that other source is PRRS testing that animal, before it's getting shipped. So if that's not happening, hopefully you have an isolation facility far away from your farm.
Is a month good, would you say?
A month is probably good. You'd probably be seeing signs. So best case scenario, you could get a vet out to even test that animal. Bleeding the pig is something that is different from bleeding any other animal, if anybody's seen that before. So a lot of vets are not comfortable with that. What I will tell you is a great way to test for those if they are not comfortable with bleeding is something that's called oral fluids. Have you ever heard of that? I mean, it's like the most simple technology. Anybody could do it. You don't have to be a vet to be able to do this. But essentially, you're taking cotton rope and hanging it in a pen or hanging off debt, letting it chew off it, and you're extracting that saliva. That can be PRRS tested. So your vet can collect that or whatever. And then send that off to be tested, so you could get your answer there. So that's a lot easier than bleeding pigs. So that's a good way to do it. But yeah, isolation would be best case scenario. Know what you're buying. Best case scenario as well. A month.
If anybody in this room has a problem, I'm sure the people that draw blood for the state They will help you with that.
Okay, yeah, there you go.
Yeah.
Yeah.
Yeah, I often will draw extra samples
Okay.
for, whatever, because we're doing pseudorabies and brucellosis surveillance.
Right.
But if there's something in addition that a farmer wants, I'm always willing to draw extra
Yeah.
tubes.
Because those guys are very good to have a good rapport with.
Mm-hmm.
The guys that are out in the field really working, they draw blood like it's nothing.
Oh, okay, good. Yeah, it's fine. It's sometimes hard. Well, at least, we got some people capable of doing it. It's not rocket science, but it's not like bleeding any other animal. So, once you know how to do it, you know how to do it. But it's having the confidence to know what you're doing.
The only thing is they're getting old like me.
Okay. There you go. Well, I guess Alicia knows how to do it. Some people know how to do it. So.
Yeah, so USDA is based out of Sutton, Mass, and there's a veterinarian that covers each of our New England states. And their staff is often a supplemental help for our state departments of agriculture. And there's 4 of their staff attending tomorrow's workshop. So they've realized this gap in swine health in our region. And they're really committed to becoming more involved in that. And they work very closely with our state departments of agriculture.
Thank you. Card for you.
Yeah, absolutely.
Good. But yeah, to your point, I mean, you should be scared about it. Everybody should be scared about it. It should be on your mind, because if you get it, it's a nightmare. Farms your size, it's almost, some people choose to depopulate completely, or have a closed herd for a long amount of time. Somebody have to take a break in breeding, that sort of thing, to try to get rid of it, try to push it out. It's costly, so the best thing is to not get it.
Yeah.
But should always be on your mind. Like I said, obviously you guys are in much lower risk compared to some of our other states, but hey, you're still at risk, especially from what I hear. And hearing that scares me, because I know there's a lot of diseases there at any buying facility.
Right.
So yeah, you should be nervous about that. It should always be on your radar. Know who's coming on your farm. Know what you're buying. So. Yeah, and back to vaccination. Sorry, kind of got sidetracked on that. So there is. We could talk about this for a while, but my thing is, I'm not a huge fan of the vaccine, any PRRS vaccine. So there's modified live versions of a PRRS vaccine, and there's killed versions of a PRRS vaccine. Again, all you're kind of doing is decreasing the clinical signs, decrease the amount of shedding, so how much virus that animal's spreading off into the outside world, but they still have it, okay? So I think in certain situations, in certain areas, if I was practicing down in North Carolina, if I was practicing out in Iowa, I'd probably be using it in some of my herds, absolutely, because I know the risk is so high. But once you put a modified live PRRS vaccine into your herd, you're essentially giving your herd PRRS in a certain degree. And the vaccine's pretty safe, but I have had some herds that have used the vaccine, and it turns into what we call a wild type disease outbreak, to where those pigs act like they have just received a strain of PRRS. So yeah, it can be bad, but I certainly think in some situations it could be useful and beneficial. But I think in areas like this, and in areas out in Pennsylvania, I have very few herds on the vaccine, just very, very few herds.
Does the kill give any of those problems?
Oh yeah, sorry. So with the killed product, no. You're not having a risk of spreading it around or having some like acute kind of outbreak with it.
But it doesn't work as well.
But it's not. Yeah, exactly. So you're not stimulating the immunity as much. You use killed products actually in herds that kind of already have PRRS virus or already infected with the PRRS virus, and you're kind of just helping like stabilize the immunity a little bit. That's generally how people are using those products. So yeah, if you don't have PRRS and you're using the killed products, well, you might as well dump it on the floor. So ileitis is Bacterius Lawsonia intracellularis. So this is a common diarrhea in grow finish pigs. So clinical signs, diarrhea, can see some blood in it. Pigs are generally wasting, poor body condition score, variation in growth rates among the herd, and in acute cases can cause death. As far as the vaccination goes, there is, I should have put, it should say water vaccination. Sorry about that. So, do I have that? No. Okay, we'll talk about it. Sorry, I thought I had another slide about that. So for vaccination, there is an injectable product, which is on back order that I'll talk about, and there is a water-soluble product. So the water-soluble one is called Interasol. It's from the pharmaceutical company BI. So I would imagine, are you guys set up to water medicate, a lot of you guys, or do you guys run water medication line? I don't know what kind of.
We're small, so what we do is you shut off the water, and you get a plastic drum with a nipple on it, and put it in there.
Okay, I gotcha. All right, let's listen. So probably what I would recommend for like situations like that, you can just orally dose it. So that's what most people do. Around weaning time-ish. So the vaccine is, the strategic placement of the vaccine is technically you're supposed to have it at least 7 weeks prior to your typical exposure of ileitis, which unless you're going through and doing a lot of diagnostics at your farm, you don't really know what that is. I will say in my ABF herds that I work with, because we're not using any sort of antibiotics, they seem to be challenged with ileitis a lot earlier than you would see in a typical commercial farm. So lots of times I might not see ileitis till pigs are 125 pounds. Well, in some of my ABF herds, I'm seeing pigs at 50 pounds get ileitis, which is a little bit more unusual. So in people that are not using a lot of antibiotics, even smaller herds, I'd say to even do that shot at weaning, or actually even a little 2 weeks of age, you can even do it as early as that.
Does weaning a little later help with that?
Not really, yeah. I mean, because again, the bacteria is one of those that's kind of just lives around, so they're certainly still susceptible to it. It's going to be less common while they're still on the sow, but once they get off, they're just as equally as risky as anybody else, I would say. But yeah, so yeah, that's Interasol ileitis. Oral administration of that. The caveat with that is you need to have a antibiotic-free window. So 3 days prior to you giving the vaccination and 3 days after, no antibiotics. So it ends up being a week total. So 3 days before, vaccinate, 3 days after. So you're a week without antibiotics in those pigs. That's important to remember. The injectable vaccination is called Porcellus ileitis. That's made by Merck. That is on back order. That was great because it was an injection. People like that as opposed to orally dosing a pig. You did not have to have an antibiotic-free window. That came on the market. It was kind of slow to start. It's because people, knew that the other vaccine worked well, even though it was a little bit of a pain. It worked well, but that vaccine started to gain ground. A lot of people started switching it. They had manufacturing issues. It's been on back order for, gosh, I don't know, at least 6 months, if not more. And I met with a Merck drug rep not too long ago, and he made it sound like maybe February it was coming back, which means to me, like, I don't know, maybe next summer. I don't know. So you never know with the drug companies. So once that comes back, I think that's a great option to use because especially with the Interasol ileitis, so the oral one, the smallest thing it comes in is a 50-dose vial, and you have to use them all at one time. So especially for small guys like yourselves, it kind of can be very not efficient and not a good choice economically. The injection, you'd be able to kind of just dose that out as needed, so that's a great option whenever that comes back on the market. So, also, control of ileitis is used through feed medications, pulses of feed medication, and injectable antibiotics can also help in the treatment of that as well. Thailand is probably the big one that you give a shot of if you were dealing with that out in the herd. So this kind of gets into growing pig vaccination. So I threw iron up there. It's not a vaccine, but I do want to talk about that briefly. So is everybody giving iron shots? Or some people, is anybody not giving an iron shot? I run into that a decent amount. Anybody not? Okay, good. Some people, you know, like, so pigs don't get any iron they're born with very little iron. They're not getting much from mom in the milk. You know, back in the day when pigs were raised out in pasture, they're picking it up from the soil, but who knows how iron rich their soil is? Probably nobody unless you're getting it tested, right? So I run into that run into that a lot on farms that have pigs on pasture, like, oh, we're just getting it from the soil. Well, you don't know how iron rich your soil is. So iron's dirt cheap. Just give the pigs a shot of the iron. They need it. It helps out with a lot. It helps out with a lot of growth and immune function. So you might as well just give it. The other thing I like to say too is to check your bottle. Iron can come in 100 milligram per ml and 200 milligram per ml bottles. They need 200. So I don't care what you buy, just make sure they're getting 200 milligrams. It was kind of an old-timey thing that they only needed 100 or 150. That was based upon a pig 50 years ago. That was a lot smaller, not growing as fast. So we know now at least 200. Sometimes even really fast-growing pigs, they give 250. So at least 200. The day they're born, the day after they're born. Don't give it at 2 weeks. They've already depleted. They need it within that first day or two of life to give them that iron. Also, that time is when a lot of people give like a little bit of a penicillin too if you're using antibiotics, and that's to help with umbilical infections, umbilical hernias.
Do you still offer the Draxin iron, and there was something else?
Penicillin.
Yeah.
We have a compounded product at our office. People call it IPD. You've probably seen that around. So that's something that we do at our office. You have to be a client in order to receive that because that's technically an autogenous type product. Yeah, a lot of people in the show pig world use that. So yeah, using the penicillin to help with the umbilical care and the Draxin in situations where there's kind of some respiratory challenges there in the farrowing house. So
If you were to give the pig some penicillin, you know, at the iron shot in the first 3 days, how much would you give that baby?
Yeah, it's not much. It's 0.1. That's all it is. Yeah, which I know is teeny tiny, but yeah, they don't need much. But umbilical hernias are especially, yeah, I deal with that a lot in ABF herds because you're not given penicillin. I mean, there's been a lot of research to show that giving that little bit of penicillin at day one is really decreases the amount of umbilical hernias that you see, not until a pig's in the finishing phase. Because what happens is they get a little local infection right there at the umbilicus. It's just a small hole. As the pig grows, that defect gets bigger and bigger. Usually once they start growing really fast, the hole gets big enough, the intestines kind of push through there. So you don't see the effect of that for another couple of months, but usually it's just a little local infection. Good umbilical care is also important.
Yeah, dipping in iodine?
Yeah, dipping in iodine, drying it off, dipping in iodine. I don't like, some people have the practice of, after the pig was born, cutting them off or that kind of thing. I don't like that. I think just leave them be. They'll come off naturally, but don't rip them off.
No, how about, I've read you cut them off so they're not dragging?
Okay, yeah. So yeah, if they're super long, I don't mind cutting them a little bit. I mean, yeah. So some people will like kind of cut them right at the umbilicus. So yeah, no, I'm not a fan of that at all. If they're some that are kind of excessively long, or the other piglets are stomping on it, that I don't mind. Yeah, and then dipping them in iodine, drying them off. So important. Yeah. Some people would tie them off. Don't mess with it. It's God put it there. It's supposed to be there. It'll come off naturally, but you should try to keep it dry. Dip it in iodine. So, yeah. Good point. Okay, so back to the vaccines. So the PCV mycoplasma, again, like we talked about with the breeding herds, so that's a combined shot. I'd say most commonly people give this at weaning. Or a little bit after. There's several products, big products out there. The Zoetis one is called Foster PCVMH. The one from BI is called a Circoflex Mycoflex. This one comes from a drug company called Merck. It's called Circumvent PCV, what was it, G2, or I forget the name of that one. Several big, and those are the big companies, those are the big ones that you see out there. The one caveat with this, so 1 dose or 2 dose, if you look at the bottles, some of them will have the option to either do a 1 dose, 2 cc's, or 2 doses, 2 to 3 weeks apart, 1 cc and 1 cc. So obviously what's easier, right? Doing 1 shot at one time. The idea behind doing the 2 shots is promoting better immunity. It's probably a little bit better for the pigs, especially in terms of actually mycoplasma. And herds that have kind of more challenges and more issues with mycoplasma, I actually think you get a little bit better coverage and a little bit better immunity by doing a 2-shot deal. So that's kind of a thing that you work out with your veterinarian specifically. But as long as they're getting something, that's a heck of a lot better than nothing. I certainly recognize that, doing 1 shot at weaning is a lot easier than going around in the nursery, running around and picking them up and giving them another shot. But 2 shots is probably preferable. But the ileitis vaccine we chatted about, that's, as earliest I'm doing it like 2 weeks of age in a lot of my ABF herds or herds that I know have issues with it. Otherwise, you can do it even sometimes someone in the nursery phase up to about 40, 50 pounds is when people are doing it. And again, this is, if you're making your own breeding stock, you're making your own gilts for replacements, a lot of the stuff gets boosted, I would say, when they're, coming into the breeding herd around 5 months of age or so. Parasites, we'll chat about that in the next lecture. Situational things, just depends on the challenges of the herd, right? So a lot of these are just based on historic problems that are going on or challenges that we expect them to have. So we've got a list of a lot of bacteria and then either flu or PRRS. I would say it just depends. It just depends what you're dealing with. So there's options out there for disease. Probably one of the more common things I would add in would be E. coli. So you can see a lot of E. coli, most of E. coli in herds. Salmonella is probably a big one that I vaccinate for. A decent amount. Just depends on the situation. So. Let me see what else. Okay, that's all I got. Okay, so I just took this off some protocol I had for one of my clients. So this is probably just like the most basic thing ever. So this is kind of what it looks like when I submit something to a client. So I broke out stages of production, our product, doses, route, withdrawal times. Always remember, pretty much most all vaccines are 21-day withdrawals. If you were guessing, you can just guess 21, but most all of them are 21 days, so something to bear in mind always. So we have, we can start with our incoming breeding stock. We're boosting with this Fostera PCVMH. They're getting the enterosal ileitis. Our sows are getting their Flusher or Fairshire Gold pre-breeding. Gilts are getting the 2 doses of that. And the boars, of course, are getting the Fairshire Gold Flusher twice a year. So that's just an example of a very basic sow herd. And vaccination protocol for some growing pigs. Again, our iron penicillin, the 200 milligrams, 0.1 of the penicillin. This one we're doing that Fostera PCVMH, 1 cc at weaning, another one 3 weeks later. And in this site, we're doing a 3 weeks post-wean where they're doing the ileitis. So that's a very basic, kind of almost bare minimum vaccine protocol. Yeah. Big thing with penicillin too, don't forget, super long withdrawal. I mean, it doesn't, for a baby pig, it's not a huge thing, but I can't remember what the bottle says anymore. I think the bottle's 7 days or 14 days or something, but that's at the labeled dose of penicillin, which nobody gives a labeled dose of penicillin. So we follow about a 50-day withdrawal time on our penicillin administration. That's the one that if you read about residues, meat residues coming up, it's almost always for penicillin because the test is very good. It was probably too good. It's very sensitive. So when you read about people getting in trouble, it's usually with penicillin. So I actually don't really use much penicillin at all. I try not to recommend it. A lot of companies actually will say that they can't even use penicillin at all. Even in the sow herd or anything like that. Sometimes, at least with the growing pigs, but they might say they can't use penicillin at all. So a lot of the big companies, because they're so worried about, withdrawal times and meat residues, so.
Is there a
Questions?
place for penicillin if you use it right?
Yeah, but
Repeat the question.
Oh, yeah, sorry. Oh, yeah, I'm sorry. So the question was, is there a place for penicillin? Oh, sorry about that. There is, but I would say it's not my favorite, your favorite drug. To be honest, the only thing we really are using for other than, on the piglets there, day one, it still is good for, treatment of erysipelas, which is probably the only indication that really has on there that we use it for. Other than that, I really don't use it. And again, a lot of it stems back to that withdrawal time, because gosh, I mean, that puts you in a bind with that withdrawal time. And there's just a lot better options out there. I mean, to be honest, from an efficacious standpoint, I don't think it really does that great of a job anymore. And that's just because, it's one of those that's just been around for a really long time, the drug itself, and probably, some drug resistance to some certain diseases. It's certainly not my go-to,
So if you had a weaned pig with a little bit of respiratory problem,
Mm-hmm.
what would you give it that you could get off the shelf?
I don't think there's really off the shelf that you can get anymore.
LA200?
Yeah, which is so that's tetracycline. It's okay. It's probably not great. Yeah, that's one that my go-to would be some sort of Picefefdifure product, which is, again, you have to have a prescription, has your Exceed, XNL sort of thing. Baytril, enrofloxacin, gets a lot of respiratory bugs. Draxin gets a lot of respiratory bugs. But yeah, the over-the-counter stuff, it really is.
Useless.
Yeah. What other questions? Vaccines or disease stuff that we didn't talk about, didn't go to. Are you guys doing a lot of this or some of this, or at least maybe the Fair Gold at least? I feel like that's usually the one that I use. Most people.
What's the plus in Fair Gold? There's Fair Gold.
Oh, yeah.
Gold Plus.
Yeah, so, the question was the Fair Gold Plus is the question. So, that adds an additional leptovirus. So there's
That's right.
Yeah, Bratislava, I believe, is the one they added, if I remember correctly.
And that's a little bit more expensive than.
I believe so,
Is it
yeah.
worth it, or?
I don't think so, to be completely honest, no. No, I don't think so. I mean, again, so lepto is something they can get from wild animals. So, herds that are out on pasture, out in the woods, something like that, they're going to be certainly more at risk for contracting lepto. So I would say if I had a herd that was living all out in the woods, maybe, because your risk is going to be higher. But otherwise, I don't think it's really to your benefit. I don't think it's worth the extra cost.
Are you familiar with the Majestic 7? Is that just as... It's something that people have offered as like an alternative.
Yeah.
It's a lot less expensive than
the other one.
Sure.
Mm-hmm. I'm not familiar with that one. I know there's a bunch out there.
Yeah,
I
there's
can't.
that. There's a couple of others that don't have everything in them, but
Mm-hmm. Yeah, I'm not familiar with that one specifically. The Fair Shirts is that's just the big one out there. Some of the other ones just probably have less leptospira strains in it, which would be my guess. And some of it, like I said, that's kind of the relative risk. Really, like the thing I care about most. I mean, I care about all of them, but if I was to pick, the thing I care about the most is your parvovirus protection, because I think that is the most prevalent out of those three, and all of those have good parvovirus.
Lepto seems to be common up here as well, though.
Is that more common up here? Okay.
Very heavy deer population.
Okay, well then, yeah,
So
okay.
if you're doing any pasture.
Mm-hmm. Okay. Yeah, so maybe that would be more important up here. So certainly, for a commercial herd that's living inside, the risks are low. So sometimes, it's the relative risk there. So. Anything else?
The Farisher Gold,
Mm-hmm.
there's no chance that any Buddy breaks it down into smaller bottles.
Oh, yeah. Yeah, I have to talk to the drug companies about that. The question was about the size of Verisure Gold. Yeah, that's, talk to your drug companies, I know, yeah.
I noticed a lot of the different stuff like PG 600 now, they've gotten rid of the single dose and
Mm-hmm, yeah,
you
that's
now have to buy the full.
the full dose, yeah. And that one's on an allotment too. I don't know if you guys are aware of that or not. We'll get into, well, I'm sure I'll talk about PG 600 later in one of these other lectures. That's on a, they're having supply issues, which probably is not going to go away. So the U.S., well, I shouldn't say the U.S., every country is on a designated allotment now. What I've heard from the companies that we're getting probably 80% of what we need. So and that was probably not going to get better over the next couple of years. So they're having trouble. So they get pregnant mare hormone, and there's a human hormone in that product. I don't know if it's issues with one or both. I'm not sure, but it's a supply issue. So yeah, we're having trouble getting what we need for sure. We can't give it out to everybody, and it seems like it's going to be that way over the next couple of years. So if your vet has it, hold on to it. So yeah.